And now, a segment from the Best of the Night Side with Barb DiGiulio podcast. Listen and download the latest podcast at Newstalk1010.com.
Welcome back to the show. Special guest this hour. He's a friend of the Night Side, Dr. Stephen Mulholland, one of Canada's leading cosmetic plastic surgeons. It is SpaMedica at Avenue Road in Bloor.
66 Avenue Road.
Welcome back to the show.
Thank you very much, Barb.
It's great to see you. How have things been going?
Very, very busy. Very busy getting ready for TIFF, of course, in Toronto. So the local Luminata will always time their rejuvenations for crescendoing in early September.
Is TIFF a thing, or not TIFF in general, but are there any times where you find people don't want to run into other people? Can they sneak in one door and sneak out another? And
you know, it's an issue in my industry, particularly in my practice. I have a lot of patients who are on TV or on air, on stage, or on film. And in fact, you're absolutely right. I built a side door about 18 years ago. So people could come up from an elevator, sneak in a side door and a back door and not have to walk through the lobby. And that's important. And even if you aren't a sort of a celebrity or think you are, no one wants to look all bruised and somewhat deformed and walk out through the lobby where there's... And as a business owner, you don't want to scare the next patient. So that side door has been very useful for many reasons.
416-872-1010. You can text us at 71010. Dr. Stephen Mulholland, cosmetic plastic surgeon. He is here for the hour. He will answer any of your questions. And one of the first things you and I started talking about, and I didn't even tell you that I was watching a PVR'd version of I Am Kate today. I caught like 20 minutes of it because I wanted to see the Kris Jenner showdown with Caitlyn. Transgender surgery.
Yeah, sex assignment, reassignment surgery, and transgender or transsexual, and they are two different things, really is a big process here in Ontario and actually most provinces. It requires a psychological assessment and co-commitment from a psychological support team, really. And it is covered by the managed care system, Ontario Health Insurance Plan, most of the procedures, but you need to qualify, and it really rules out to a large extent what could be, patients that could be really victimized by their psychiatric conditions, perhaps, and so or psychological perspective. So I think we have a very safe system here in Canada that allows transgender and transsexual and genital reassignment surgery to be done safely and effectively and covered.
We'll continue on with that. And we've got a caller who I think has a question along the lines of sort of mental screening. Chris, welcome to the Night Side. Go ahead with Dr. Mulholland.
Hey, how you doing?
Good, thanks.
And how you doing, doctor?
Very good, Chris. Thanks for calling.
Okay, I just had a quick question. It's a good thing that you mentioned you guys have a support system set up for people that do sexual reassignment, but what about a support system set up for people that are young and maybe having mental issues or extreme insecurity issues, and they feel that they need plastic surgery in order to better themselves? Is there a screening process for them or a support for them after the fact?
First of all, it's an excellent question, and that's one of the major obstacles that you face when screening a patient. Is the patient doing it for the right reasons? Are there underlying emotional or psychological issues that are really not in the patient's best interest to have surgery at that time? So most good plastic surgeons who've been doing this for some time, contraindications include depression, recent bereavement, loss, grief, or doing it for secondary gain reasons that really are unrealistic. For example, trying to find a mate or find someone else. In general, you're never going to solve life issues like that with cosmetic surgery. So that's part of the screening process. And if someone does have mental issues, or they're depressed and not stabilized, or they have anxiety disorders or personality traits like antisocial, borderline, narcissist personality traits, we send quite frequently patients for counseling first, and unless they get cleared by a psychiatrist, they're really not candidates for plastic surgery.
How do people react when you suggest, I'm sure in your very diplomatic way, that they need to do this before I can help you?
The ones that truly are not well, depressed, or are really suffering from some organic vegetative state, they're quite thankful and in fact relieved. Those that have personality traits that are usually ego dystonic, like the borderline or the antisocial or the schizoaffective traits, they're quite angry because they have a personality disorder and they're being told no, they can't do something because it's probably not in their best interest. They can be quite upset. And it's a shocking statistic, and this was an excellent call of Chris, that 15%, 15 of all plastic surgery patients who present for aesthetic surgery have body dysmorphic disorder, meaning, so BDD is a disorder where you can never, ever actually be happy with how you look, no matter how much surgery. So I've always said that as a plastic surgeon, you need to be the best psychiatrist. You have 10 minutes, where a psychiatrist at least has an hour to really determine, is this person psychologically stable, so they're not being parasitized or taken advantage by the perception of cosmetic surgery at the expense of their mental wellness.
Well, that's funny because we found a study that said 1 in 5 people are unhappy with their plastic surgery results. Does that surprise you?
1 in 5 at 20%, I would say across the board, likely an American statistic.
Probably, yes.
It is very high, but I would certainly say that even in a practice where patients are well screened and they don't have mental illness and they're not vegetatively depressed, the number one risk is that patients' expectations exceed what can be done. So they have their eye on an outcome, and we don't do a good job communicating if we don't, and patients can have an excellent result and still be unhappy. And that's our fault. I would say 20% is pretty high, but certainly 5 to 10% in certain procedures, rhinoplasty, liposuction, some of the more three-dimensional procedures, patients can be unhappy, not because it was a bad result, but because we as a specialty didn't communicate well the kind of results they should have expected.
Oh, okay. I know that when women have a bad hair situation, they'll always say, go back to the person who did it. If someone comes to you and says, so-and-so did this plastic surgery on me and I hate it, do you do a lot of the fixing of the botched work, as it were?
We've mentioned the botched show before, that American and Los Angeles-based show. There really isn't a lot of botched surgery where things are done badly here in Canada. We're very fortunate. We have well-trained surgeons. To do surgery in Canada, you have to be a plastic surgeon. You can't, in Ontario, for instance, call yourself a surgeon to be a family doctor. Where in the United States, and anyone can call themselves a cosmetic surgeon. So there are a lot more botched surgeries, as it were. Here in Ontario and in Canada, we're quite fortunate in that we have very, very good surgeons. So, but do patients come in and they've been somewhere else, they've had surgery and they're unhappy? I generally say, you're in your best interest to go back, talk to your surgeon. We all, as surgeons, have a real interest in making sure our patients are happy. And it's often economically beneficial to go back and see your original surgeon for any revision or enhancement surgery, because we generally don't charge surgical fees to fix something that maybe isn't quite right or not to the patient's expectation. So I always try to send them back to their own physician, and generally don't try to undermine the physician, because they know best what went on at the time of surgery, and you really can't second guess as a backseat driver.
416-872-1010. Dr. Stephen Mulholland is here from SpaMedica. He's one of Canada's leading cosmetic plastic surgeons. You can text in your questions at 71010 or give us a call. Stephanie, hang on. We're going to get to you just as soon as we take a quick break for traffic. You're listening to The Night Side. Welcome back to the show this hour. Dr. Stephen Mulholland is here from SpaMedica. He is one of Canada's leading cosmetic plastic surgeons, and he's here to take your calls on anything to do, any questions you have about cosmetic surgery. 416-872-1010. You can text us at 71010. Stephanie in Markham has been waiting very patiently. Hi, Stephanie. Thanks for holding.
Oh, thank you for having my call.
Sure, go ahead.
So I've been blessed with a big cup size but a small waist. So buying clothes isn't very easy. So I've always thought about getting a reduction done. However, I've always been told that, wait it out, because when you have children, they're only going to get bigger. And then you might want to get it done then because it can affect breastfeeding. I was wondering, is that true? Because it is a convenience at the moment, but it hasn't been hindering like back pain yet. So I was just wondering in regards to that.
It's a great question.
How old are you, Stephanie?
I'm 26.
Okay, so you're very young and anticipating children, as most young women do. And so one of the questions we often get asked is, can I breastfeed? And about 85% of all breast reduction patients can breastfeed successfully. And if you look at women across the board, only about 90% of women without any breast surgery can. So you only lose about 5 to 10% of that probability. So it's unlikely that it'll affect your breastfeeding. And so your other concern, and as rightly so, is that your breasts will change with children. They'll get bigger and smaller with breastfeeding, and they may get somewhat droopy in addition to larger. But in general, most patients who are young seek out cosmetic breast surgery through breast reduction, which if you have certain symptoms or a certain size is covered by managed care because they want to look good at the age they're at. And you might not meet the right man and have kids for a decade. That means you're depriving yourself of the figure, shape, and form you want now. So
That's a good point.
I hear both sides of it, and it really comes down to what do you want to achieve now? Are you compromising breastfeeding? The answer is usually no. And breast reduction is something that many women do just to bring their breast waist-hip ratio back into the same general proportion.
Yeah, because even buying a bra isn't that easy.
Right. No, and so if you're very athletic and sporting, and obviously a large breast can leave you self-conscious in certain circumstances. So it's probably the most common thing that's done under the OHIP health insurance plan for the body in the area of plastic surgery.
I was just going to ask, thanks for your call, Stephanie. I was just going to ask you, is it covered under OHIP?
Yeah, it's covered if you have symptoms like back pain, neck pain, under the breast, discomfort, or if it's just very large without symptoms because you're young and healthy and you haven't got degeneration yet. And it generally you submit some photos to the Ontario Health Insurance Plan or OHIP, and most of the time if a surgeon says this patient has the criteria for breast reduction is covered.
Do people who don't need to have it covered get it covered, if you know what I mean?
Yeah, there are some patients that know what to say and come in, and they're actually not that big, but they're droopy, but a breast lift is not covered by OHIP. And so or any provincial health insurance plan, so if you have droopiness and you create a story that you've got symptoms of enlargement, sometimes you'll try to get that covered by OHIP. But for the most part, most plastic surgeons are pretty astute about, what is and isn't and shouldn't be covered. And most hospitals, if you were to start doing a bunch of breast lifts, they are certainly liable and culpable, and there would be some complaints within the operating room community. So most patients who have breast lifts are told, no, this would not be covered. You need to have a breast lift, and that's a private insured patient.
Dr. Stephen Mulholland is here, cosmetic plastic surgeon, 416-872-1010. You talked about people coming in to get freshened up before TIFF. What is the least invasive way for someone to instantly boost their look? And maybe least expensive too. Mm-hmm. They may not be one and the same.
And this is an excellent question. Medical skincare works very quickly. You give you a bright, glowy look, a dewy look, a photofacial or a little laser tweak where light is used to brighten your skin. That's an instant fix with very little risk. Then you move up the ladder to needle-based procedures like Botox, where you can soften wrinkle lines and frown lines and angry lines and crow's feet, or a soft tissue filler you can fill in deflated areas. Again, very simple things that can, within 30 minutes, can change your look and soften your look or rejuvenate or reverse a tired appearance. And so needle-based treatments, topical skincare treatments, and laser treatments, those are sort of your triad or your three-leg chair of early entrance into looking your best.
And what are people looking at spending for those kinds of procedures?
Well, that's an excellent question. Usually the least possible to look their best. In general, most things are reasonably affordable and surprisingly so. So you could do for a few $100s, you could do a peel, a small amount of Botox, and within 3 days look 5 years younger.
Wow.
So, now, of course, it does wear off. So there's kind of a sort of a heroin-esque sort of addiction to this stuff, where if you talk to some of your friends who are doing procedures, it's quite addictive, looking good, feeling good. You have that little extra bounce in your step, and your skin looks great, and it wears off. And of course, then you have to go back for maintenance. And so a lot of patients, when they first start, don't like the concept of maintenance, but any woman knows that anything you're going to do, color your hair, do your nails, it's going to wear off, and the non-invasive surgical treatments wear off as well. Usually about once every 3 months, you're going into a plastic surgeon or dermatologist's office and doing some needle-based or laser-based, I want to look 5 years younger sort of treatment.
Sure. We have talked before about this trend among young people to get surgery. Teenagers who are doing, teenagers are doing fillers, and they're doing Botox. So if girls are starting that young, will that have a negative effect on their skin? Will it make their, like if you're getting your lips boosted every 6 months when you're 18 years old, when you're 40, does that have a bad effect?
It's a common question that I'll get. Patients are worried if they do something and then it wears off, will they sort of cascade into some aged, accelerated perspective that they wouldn't have had?
Yeah.
And the answer is no, it isn't. It actually retards the aging process. If you soften the wrinkles with Botox, the wrinkles you would have had don't form. If you stop using it, they will form again. But the time that you used it, 3 months or 30 years, will put that process in an arrest.
Oh.
So the question becomes, what if you start young? What happens? Well, the lines you would have normally formed just don't form. And there are great twin studies out there, identical twins separated at birth. One is raised in the heat of the Ukraine and a farmer, and one is in the lap of luxury in Paris. And this is a well-known twin study. And they got together at age 65, and one had the advantage in Paris of cosmetic surgery, Botox, and filler, and the other didn't, and they look like two totally different people,
like 20 years apart
at least. And so, when is the right time to start? I think if you're a teenager, cosmetic surgery, plastic surgery in general, just doesn't mix. It's hard to be a teenager and have confidence and a good, healthy self-image without mixing it with surgery. But we talked about this before. I've talked on many shows about the 10 and 10, that in the last 10 years, the average age of people coming in for their initial Botox is 10 years younger. It used to be 42. It's now 32.
Wow.
And a lot of these young girls come in and they say, I really love my mom. I just don't want to look like her. And I can see where the lines are forming, and I'm just going to stop them in the tracks. And, I call this prejuvenation. There's no age here. This is attacking like a military strike at the heart of aging before it starts.
Yeah, it's something we've never really seen before.
And these young millennials, they're smart. They're smart people. They realize it's a competitive job market. I'm not maybe doing it for vanity. I'm doing it because I just don't want to get old. And in this job market, unfortunately, every little difference sometimes matters.
For sure. 416-872-1010. Text us at 71010. Dr. Stephen Mulholland is here until 9 o'clock. We've got calls coming in. We will get to them when we after we take a quick break. And we're also going to talk about whether or not cosmetic surgery is safe for seniors. We'll do that when we return. You're listening to The Night Side. Welcome back to the show. Dr. Stephen Mulholland is my guest, cosmetic plastic surgeon at SpaMedica here in Toronto, Avenue Road and Bloor. And he's taking your calls and questions on anything to do with plastic surgery, fillers, Botox, adjustments, whatever it is you're thinking about having done. If you have any questions, give us a call, 416-872-1010. You can text us at 71010. We'll go right back to the phones because Donna has been waiting patiently. Hi, Donna. Go ahead. You're on with Dr. Mulholland.
Hi, Dr. Mulholland.
Hi, thanks for the call, Don.
I was the lucky person who was, I believe, the first person in Canada to basically have their face ruined by Articol.
Yes, there's a number of fillers that one wishes when you look back at Health Canada decisions, Articol, Dermalive, Bioalchemid, even liquid silicone. And so what happened? What problems did it cause?
I chose a top-rated plastic surgeon who to this day is top-rated. I basically went in and said that I wanted to have a few injections to fill out my upper lip slightly, and injections in the corners of my mouth, because I was just beginning to show some marionette shading starting.
Mm-hmm.
So the doctor chose the product. I basically said, what I wanted to accomplish, and he chose the product. He was very excited about it. I think on the 2 days I was in his office, Articol had just been licensed about 6 days earlier.
Wow.
So he was very excited about using it, and he had no idea what was to come. 2.5 years, and so I had 2 visits with him. 2.5 years later is when the reaction occurred.
Oh, really?
Yes.
Okay.
And that's when I learned that the follow-up studies done by Health Canada were only for 24 months post-injection.
And you were left with lumpiness?
So, right. So what I had was I had large red lumps, a large red lump on my right upper lip and in the corners of both my mouth. We tried cortisone shots for several months.
Mm-hmm.
Nothing settled down. I was referred to another top plastic surgeon who tried to scoop out some of the plexiglass beads from the left corner of my mouth. I have a fine scar now down the left side of my mouth. It's not a long scar, but it's actually gives the appearance of a marionette line, which is what I was trying to avoid.
Donna, do you have a specific question about for Dr. Mulholland?
Yes. I did an awful lot of research on this, and I'm left still with a sunken lip line on my right lip that has scar tissue around it. I was wondering if I know I can't ever recover my lip line, but I'm just wondering if anything can be done to smooth the skin around that scar, that scarred kind of skin on that area of the upper lip. And also, I've heard that there was a doctor in Italy that has been melting these plexiglass beads. I don't know. I'm wondering if anyone in Toronto has been able to melt. I have a disfigured lump.
Okay.
If I press my tongue against my lips, you can see the lumps all along my upper lip. But you can especially see the lumps in the right corner of my mouth where I did not have anything removed.
That we'll see what Dr. Mulholland has to say, but I'll start by saying that, that's every woman's nightmare, is having something affect their face, and everybody can see it. It's a horrible thing.
There's a cautionary tale here, and very sorry for your outcome, because there are many patients like yourself where we as physicians, we trust and trusted Health Canada to do the type of testing that some of these injectable soft tissue fillers or even some of the early generation implants in the 80s you think would have been done. And the long-term follow-up studies actually had a lot of complications, such as these granulomas that we've been talking about. And so, cautionary tale, I think most plastic surgeons, dermatologists now, and listeners, you probably will only want to inject things that are reversible, things that are natural, like sugar gels or your own fat. And most surgeons and physicians have shied away from things that are artificial and require a host response. And so, that's cautionary tale number one. Now, once you have a nodule, and sometimes you get nodules not just from injectable products, but other issues and concerns can raise nodules. And yes, so there are things you can do. There are topical fractional lasers and other energy devices that can help scars significantly nowadays that weren't around 5, 6, 7 years ago. The plastic surgeon you're talking about, I was just with last week, actually. I know him very well in Cannes, and he practices out of Milan. And what he does is take a little smart lipo laser fiber and goes after the little lumps and granulomas. And there's a couple of surgeons in Canada that also do that. And so that's another option for people who have granulomas. And so watch out when you're getting an injectable soft tissue filler, any product that isn't your own tissue. Do your research. Health Canada approval doesn't always mean that it's had the long-term seal of approval. And trust your instincts. If it sounds permanent and too good to be true, sometimes it is.
Is Articol a product that you ever worked with?
I think everybody did. Every dermatologist and plastic surgeon did. And so we've all got some patients with Articol or with Dermalive or even sometimes Radius or Sculptra that have lumps and bumps, and we need to manage these patients. And we've got a lot more sophisticated at the tools we can use to treat these types of problems. But in general, over the last 10 years, largely because of products like Articol, most physicians have moved to just the use of the patient's own fat or off-the-shelf sugar gels that are reversible, like Juvederm and Restylane.
That's got to be, what is that like when you're using a product and then you realize what did it take, a couple of years to start seeing negative effects?
With Articol, it was the first couple of years are fine. It's usually in the 5th year, and Dermalive, the 5th, 6th, and 7th year, Bioalchemid, the 5th, 6th, 7th year. So you go into medicine to help patients, and above all else, do no harm, and all the Hippocratic Oath and all things you do. So it's horrifying when you have patients that have complications, and you were an agent in that. Yes, we were as misled by Health Canada in that era as patients were, but it still doesn't make it any better. So most physicians have an obligation to their patients, both moral, ethical, and just out of responsibility, to help them through these complications. And I just encourage your listener to seek out individuals that have treated complications of Articol or Dermalive or Bioalchemid, and those are the big 3 offenders out there.
416-872-1010. We are going to continue on with your calls. We've got Edward and Rosie waiting on the line. Hang on. We will get to your calls just as soon as we take a quick break. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at SpaMedica. You are listening to The Night Side. We continue on right now with Dr. Stephen Mulholland, cosmetic plastic surgeon, and we've got about 10 minutes to go, and we've got a whole bunch of phone calls, so we'll try to get through as many of them as we can. We will get started. And 416-872-1010 if you want to talk to Dr. Mulholland, ask him anything. Edward is next. Hi, Edward.
Yes, good evening.
Hi. Go ahead with your question.
Yes, my question is regarding rhinoplasty. Is it better, first of all, to get a plastic surgeon to do this or an ENT? And is it better basically to get somebody who does it just that? That's
an excellent question, Edward. Both ear, nose, throat, ENT, and plastic surgeons do rhinoplasty. And I would say that it's most important that you see a physician that does a lot of rhinoplasty. In this city, there's no one that does just rhinoplasty. There are those like myself or Dr. Adamson or Dr. Conrad or Dr. Solomon, or to name it, there's probably 8 or 9 guys that do a lot of rhinoplasty, but they all also do some facelifts or blepharoplasties.
My wife went to an ENT, basically a person who just did rhinoplasty.
Mm-hmm. Yeah, I would suspect, knowing the city, that was not the only thing they did. There's not one physician I know that does cosmetic rhinoplasty, and that's the only thing they do. However, I would always look for a surgeon, plastic surgeon, or ENT that does both. I was fortunate to have training in both. And the other thing that the ear, nose, throat brings to the table is the functional aspect of surgery on the nose, meaning that the most common type of rhinoplasty I do is reductive rhinoplasty. I always sit in front of a computer and I show them, after 20 years what I think it's going to look like, which is very accurate. But the most important part of that is to leave a functional nose, meaning if you make the nose smaller, you really need to address the airway. So there's certain things called the septum and internal valves and turbinates, and you want to make sure that you have a nice nose, but you can also breathe through it.
Yeah, for sure.
So I hope that helps. So
does that help, Edward?
Pick someone that does a rhino as a big part of their practice, whether they're plastic or ENT, and also does has a lot of experience in functional nose surgery, which is controlling the airway.
But that's well and good, but the problem is a lot of times is they don't want to expose their portfolio, so you don't know what they've done.
It's a good point. Generally, and this is a good time to say it, when you're searching for any surgeon, first of all, ask them how many they do of each procedure, any complications, can you see before and afters, can you talk to patients who have done it, how many years have they been doing it, how did they fix complications on their background training, check out.
You can only verify stuff at the college for anything that's been a complaint.
You're right, and that's one of the limitations. But check the college, because it happened to a complaint, they have to publish it. There's new legislation where even a complaint may have to be published, and I think that's a good thing. Check with the CMPA, see if there's been a successful malpractice suit. But in general, and you can go online to Real Self and to Yelp, City Search, RateMD, and read about the physician. You sound like if you've done a lot of due diligence, you usually find the right physician for you. But not always, and that undermines the fact that you should be shopping for a physician and interviewing as much as the physician's interviewing you.
Interesting. Edward, thanks a lot for the call. We go next to Rosie. Hey, Rosie, welcome to the show.
Hi, thank you so much. I just have a question in regards to sun-damaged dark spots.
Mm-hmm.
I think I've spent a small fortune buying everything over the counter to get rid of them. Nothing seems to work. Could you just shed some light into, is there any over-the-counter product that would work, or is this something that, plastic surgery would have to do to get rid of them?
How old are you, Rosie, or how young are you?
I'm 42 years old.
Oh, you're just a baby. That's good.
Yeah.
So.
You're young.
And so, sun damage, because we grew up, I was born in 1960, and we at least had an ozone. And back then, sunscreen, we would get baby oil and mix it with iodine and aluminum reflectors. It was horrible what we did with our skin. Now, you youngsters don't even have an ozone. So I think I see a lot more sun damaged young people nowadays. And there's some sense of immortality of the skin, that I'm not going to get old, wrinkled, and get melanoma. So first of all, sun protective factor, wear an SPF of at least 45, wear a hat. There's beautiful bronzers you can get now, Saint-Tropez and other brands that look quite natural, and so spray on tans. Now, once you do have established brown spots and discoloration, whether it's melasma or a bunch of freckles or really large sunspots that are unattractive, there's nothing over the counter that's going to be definitive. As close as it gets is something called Ultraquin, which is a 4% hydroquinone or a bleaching agent. You don't need a prescription for that, but if you've got an established big brown spot, you've probably used some Ultraquin or 4% hydroquinone yourself. It just doesn't go away completely. So then you need to see a doctor. And then, fortunately, we've got some amazing things. We've got something called a PicoSure, which removes tattoos and brown spots. We've got intense post-light photofacials. We've got some very heavy-duty bleaching creams. And so in general, there's nothing more important we do as plastic surgeons than making beautiful, bright skin and taking sun damage and brown spots and eradicating them is an important part of that. And so I would try some Ultraquin if you haven't. Generally, the more over-the-counter cosmetic things you see in the aisle of Shoppers Drug Mart, not at the back of the pharmacy, will not work. And then, of course, protect yourself from future damage.
Thank you so much.
Is that surgery you're talking about, or this is laser stuff?
One thing I mentioned is surgical. Everything can be done in the side office of a good cosmetic dermatologist or plastic surgeon with topical cream. And really, there's nothing more beautiful than bright, shiny, even skin.
Okay. Is there a long recovery process? Like if you have these kind of treatments, does your face stay red like for 3 weeks or something like that?
Yeah, so if you're going to use a laser, like an intense post-light photofacial or a PicoSure, there'll be a red discoloration and for upwards of 3 to 5 days, but then the brown spot's usually gone. If you go on a cream with some retinoic acid or retinol that's strong in hydroquinone, you will have a little bit of redness and flaking until your skin adapts. And so sometimes you got to look a little bad to look better.
Okay.
All right.
Thanks so much for your time.
Thanks for the call. We've got Cheryl next. Hey, Cheryl, welcome to the Night Side.
Hey there. Thanks for taking my call.
Sure.
So I just turned 44, and I do have good genes in that people always think I'm younger than I am. But I've started to notice in the last couple of years, like some lines in the sides of my eyes, as well as I'm starting to have like a little bit of sagging in my eyebrow. And I don't really want to do surgical procedure, but I'm wondering, is there non-surgical options where I can at least minimize it or, proactively prevent it in the future? Thank you.
Yes, that's an excellent question. So early 40s and late 30s, very, very common age to start what I would call a non-surgical strike against these early signs of aging. And so we've got such a great host of options now. We've got laser light devices, radio frequency devices. We've got the use of Botox for overactive muscles. We've got soft tissue fillers. We've got suture suspension threads. We've got so many non-surgical, I call them non-excisional techniques that, you could easily look 5 to 10 years younger and fresher and brighter without a scalpel for the rest of your life. And that's why if you look at the growth in non-surgical plastic surgery over the last 15 years, it's grown 1,000%.
Well, we talked about that last time, that one day, are we going to look back and wonder why we ever cut into people?
I think I will be viewed as some sort of vestigial anachronism of a former medical environment that was somewhat Paleolithic. And so I'm maybe we're in the last age of the dinosaurs where scalpels sort of removed things. But this young lady, you could look 10 years younger by just shopping around for centers that focus on non-surgical facial rejuvenation. Often it is in the office of a plastic surgeon that also does surgical or dermatologist, and I think you could look amazinger for the next 30 years without ever undergoing surgery.
We've got a minute left. We're going to squeeze in one more call. Mel, go ahead quickly, please.
Hi. Okay, I've lost a significant amount of weight over the last couple of years, and I've wanted to deal with the excess skin, and I'm told that the recovery is excruciating. Can you talk to that?
Mel, it's an excellent question. Congratulations on the weight loss, first of all, because that's a tricky thing for all of us to lose weight and sustain it. So if you've had some sustained weight loss and it's been over 50 pounds, and certainly if it's over 100 pounds, you'll be vexed with a bunch of skin laxity under the neck, on the arm, and particularly the tummy. And if you've got good muscle tone and you've worked on your core, you could be looking at just skin-only excisions, in which case you avoid the muscle tightening, which is what leads online to that sense of, a tummy tuck or an arm lift or neck lift is excruciating. Skin-only procedures aren't, and often if you've got a good core and you've been working out together with your weight loss, you'd be looking at a fairly tolerable belt lift, which is a common thing for guys who have lost weight. And so it takes that loose skin that hangs over the pubic area and restores that. And that can be done under local anesthesia with very little pain and discomfort.
Wow. We are out of time. Dr. Stephen Mulholland, thank you so much for this. It's always interesting.
As always, yes.
Yeah, we'll see you again soon. It's SpaMedica, and the website is?
www.SpaMedica.com.
All right, Dr. Stephen Mulholland, thanks, and we'll have you back again soon.
You've been listening to a segment from the Best of the Night Side with Barb DiGiulio podcast. Log on, listen, and download the latest podcast right now by visiting Newstalk1010.com.